Good morning. It's 9 o'clock and I'd like to call the Health and Human Services Committee meeting to order. The first item on the agenda this morning is public comment. If you wish to speak, please come to the podium, state your name, and you have 3 minutes to speak to the board. Would anyone like to speak this morning? Good morning.
Workshop in the township, and I just barely got here in time. Not that there's a crisis or anything, but as I attended the Water Quality Board meeting, they have a lot of information they're trying to get out to the public. They have small videos that they already have produced. I suggested to them that they might, in some of the times where we have meetings that are not quite prepared to start, or where they have breaks, or they go into the back room and we see the upper regions of the boardroom where the camera is just tilted up, that they might use that time, if we could find the technologies available, to run their prepared small videos to the YouTube audience that you already have, and get their information out. I'd like to recommend that to you and to the full board, if that's possible in the future. Just let me know. Thank you.
Thank you. Would anyone else like to speak? Okay, seeing none, we will go next to the approval of the agenda. Is there a motion to approve the agenda?
So moved.
Is there a second?
Support.
It's been moved and supported to approve the agenda. Is there any discussion? Seeing none, all in favor of approving the agenda, please say aye.
Aye.
Opposed, say nay. And the agenda is approved. Moving on to consent resolutions, we have one item under our consent resolutions, which is approval of the proposed minutes from the July 16, 2024 Health and Human Services Committee meeting. Is there a motion to approve the consent resolutions?
So moved.
Is there a second?
Support.
Okay. So it's been moved and supported. Is there any discussion? So all those in favor of approving the consent resolutions, please say aye.
Aye.
Say no. So the consent item is approved. As we have no action items, that moves us to our committee reports, where we will receive updates from several departments. And we will begin with Community Action Agency with Jennifer Brzezowski. Good morning.
Good morning. So just a few updates for Community Action Agency. The first major update that we have is that we have taken a temporary pause on our utility assistance program. And I believe last month is when I talked about that was likely going to be happening. This is more due to just a very, very large influx of applications coming through. So we still have some funds available, not as many as before, obviously. But the biggest reason for that is just the large influx that we receive. So we were very behind on applications, and in order to be more efficient, we took a brief pause, and it was actually nice to take that pause because we took a step back and just evaluated what some of our inefficiencies were in the whole process. So we took a look at, like, for example, what MDHHS does with their application process. And we just noticed that we were spending a lot of time going back and forth with clients to try to gather all the documentation needed for eligibility. So we're trying to make some changes internally on that process to, again, make it more efficient. And just to give some numbers, it's a little difficult because we changed data systems. But what we were able to see is that we more than tripled in the inquiries that we received since DHHS closed their utility assistance program. So again, we'll be paused until Monday. And then we'll be doing our program a little bit differently, again, similar to DHHS, and that An approved application would be when all documents are received, and then it would move on to our assessment and eligibility specialists. And we're going to try to eliminate more of that back and forth with the clients, and also give them the opportunity to come into our office if they need documents scanned. We were doing that before, but we're just going to try to do it in a more organized process. So it's a lot less back and forth with emails and phone calls and things like that, and give people the opportunity to do things in person if they need to. We also, we've had a little bit of lull with our Home Energy 101 program, and that's a program through Holland Board of Public Works and the City of Holland. It's a free program for anybody that has that service, and we have our auditors go in and do a brief educational session in the home and talk about some items that they can do or some things that they can do to lower their energy usage and their utility bills. So if anybody's interested in that program, it is on our website. Again, it's Home Energy 101 for Holland Board of Public Works customers. And we'll also be rolling out through that same program a 201. So it's a little bit elevated version of the 101, where our auditors would use what's called a blower door, and they would be able to test specifically what energy is coming in and out of the home. So our auditors would be going in and doing that blower door test, and then contractors would come in and do some work for the renters or the homeowners, which is a really great program. Lastly, our senior food program. I know, again, I've mentioned this before, always needing volunteers. I do have to give a special shout out to Scott, who works in communications. And he did an awesome job. He hung out with us and took some video of what the process looks like for our food distribution, so that volunteers have an idea what to expect if they were to volunteer for the program. So I'm anticipating seeing some of that on social media soon. And if there are lengthier videos, we'll put those on our website as well. So again, volunteer opportunities that are coming up, we have some at the end of September. And then the first week of October is our next full distribution for the senior food program. So if anybody's looking for volunteer opportunities, there is a volunteer tab on our website. And the first step that you would take is to create a profile. So you would sign in, and once you do that, then there's a full calendar of events that you can click on and sign up. So it's very user-friendly. And we would love to have as many volunteers as possible. It makes it go much smoother, especially when there's a torrential downpour and your boxes are falling apart and all the fun things are happening. So it's nice to have more hands on deck for that.
Thank
Any
you. Does anyone have any questions? Mr. Moss?
Sure. Good morning.
Good morning.
Just one quick question.
Sure.
Sorry if I missed it. Have you seen any reasons, or do you track reasons for why there's an increase in utility
Sure.
assistance requests or things like that?
Yep. It is because of the MDHHS, Michigan Department of Health and Human
Okay.
Services. They ran out of funds.
Okay, so it's a correlation
Yep, absolutely.
directly related to that. Okay.
Yeah, so since they ran out of funds, then the influx that would normally come to them with, I don't know exactly what number they have. I would imagine hundreds of caseworkers. I could be wrong. It could be less than that. We have 2.
Right.
So
So
that,
people are just looking local for other sources. They found one and then maxed it out.
Yep.
Much.
absolutely.
How about the underlying whys? Do you track kind of why people are requesting assistance?
Sure. Yeah, so I think Kendra talked a little bit about this. I could be wrong. And essentially there were more funds during COVID, right? There was a large number of funds during COVID. And because we're not getting those same CARES dollars, there's just less funding to go around. And then we're also just seeing increased costs all around, whether it be, housing, groceries, things like that. So then there's less funds for utilities.
Okay.
Yep.
Thanks.
Mhm.
Mr. Cassie?
Yeah, so when you're saying you're mirroring the DHHS process.
Yes.
Does that mean that there's a criteria change?
No,
for
so our
applicants?
grants didn't change, criteria didn't change. We are So essentially, the way DHHS works is they use a portal called My Bridges. And clients would apply online, and then if they are missing any documentation, they would get a link, and they'd have to upload documents within a certain amount of time, I believe. And then if they don't do so, then they're denied. What we were doing is we were definitely taking more time with clients, and, we're missing this, and going back and forth with emails, and trying to walk through, for example, like, oh, you don't have your social security letter. Here's how you would obtain that. So ideally, that's what we would like to be able to do, is help people through that process, but the influx was so large that we had to really back off. So DHHS they're not able to spend a lot of time going back and forth with what's missing, why is it missing, here's how you find it. So we're kind of moving to that model, at least temporarily, and it could be permanently. And if you don't have the documents, then we would deny you. We would also give you an opportunity to come in person to scan things, and do that, but it'd be a lot less of that back and forth.
Okay. So just building efficiencies of it.
Yes.
Yeah.
Yep,
Borrowing and
absolutely.
stealing.
Yep.
Yep. Shamelessly. Good.
Yes. All right, thank you.
Thank you.
Okay, next up, we have Jason Schenkel with the Department of Veterans Affairs. Good
Well,
morning.
good morning. How we doing?
Good, how are you?
Good. Quick update this morning. So our resource fair is Friday, 10 to 2 at the Holland Civic Center. Yeah, we're just down to the small details now. So we're excited for the event. We're excited to get feedback and learn from this one, seeing how this is the first one we've done in Ottawa County. So right now, we currently have over 50 organizations that have signed up to participate, ranging from county, state, federal, and nonprofits, 25 plus volunteers. The food that was donated is going to be cooked by the Holland BFW and provided for the attendees. And then we got our pallets of surplus from the federal VA, which is going to coats and sleeping bags and that stuff for those that are currently in a homeless situation or those that are at potentially homeless. So, and then on top of that, I mean, it's really a resource fair for all veterans and families. So we'll have organizations there that will provide, assistance and help and resources regardless of the veteran situation. So we're excited to be able to educate the community on what's available in West Michigan and in Ottawa County. So our committee bylaws are complete, went through our Veterans Affairs Committee for review. It also went through legal. So they're ready for the Planning and Policy Committee to review those. July report, burial allowance, we had one. We had 2 Ottawa County Veterans Affairs emergent funding for a total of $26,3880. One Michigan Veterans Trust Fund case for $12,289. We had 35 transportation rides. The VSO appointments, we only had 10 available days in July with 48 appointments. So we did have our VFW VSO turned his resignation in. So he was actually out for air guard orders for the summer anyway, and then he's coming back and he resigned. So we're working with the VFW to understand what their process is in replacing him. So that took really probably 10 days off the calendar to have a VSO present. They are sending David down from Muskegon on Tuesdays to help with that gap until they figure out what their staffing is going to be. And then Cheryl, who's with the VVA, is going to take a day from Allegan and come up to Ottawa and fill in on Thursdays. So that will give us 5 days of VSOs to kind of handle the influx that we have right now. Currently, we're at about 4 weeks out on scheduling. So if we went back to January, February, we were probably scheduling a week or 2 weeks out. So, and with only doing 48 appointments, that puts us down close to 20 appointments a month that we're not filling. So we definitely need to get that fixed up as soon as we can. So other than that, the resource fair is really what's forefront. So questions?
Any questions? All right, thank you.
All right, thank you.
And next up, we have Dr. Michael Brashears from Community Mental Health.
Good morning.
Morning.
All right, CMH update. Wow, I could be here for 2 hours.
Excellent.
Lot going on in one of the county's largest departments. We're up to over 170 employees. Up to $78 million in contracts that we have to manage, 5 different funding sources. Been knee-deep in learning what our obligations are attached to all of those. So for the public and the commissioners to know, starting, I did it the Friday before Labor Day, so we'll see if that works. But Fridays, starting August 30th and through September, you'll see posted on the CMH website a series of dialogues from 12 to 2 if people are around. For me, educating the board, the community, staff, on our different funding sources, our obligations to them, and how we're delivering those services. So they will be recorded. It is Friday, so I know, but figured got to pick a day, get to do it. It's part of our approach to continuously educate the community to ensure the word community and community mental health. What I'm afraid of is that CMH has turned into a major Medicaid health plan. And in essence, if we act like a health plan, there's really no place for community dialogue, community and stakeholder input. And frankly, all of the services that we provide should be in the service of the people we serve and not a bureaucratic healthcare system. We have those and they work well for what they're doing. But so that is an update in terms of upcoming meetings. We'll post it on the CMH website. I also have the opportunity to send to the CMH board our current organizational chart. I'm making some last minute revisions to it, and that will be posted on the website for people to see. There's a lot of people on it. So when you read our organizational chart, it actually doesn't answer a fundamental question. Where do I go when I have a question about a service? So I'm in the process of taking that organizational chart and creating a companion document of have a question on this, call this person. Here's their contact information. Because if not, you're going to navigate through 5 or 6 pages of staff and go, and great structure. We are blessed as a department to have a balance of directly operated services that we do as a county with our staff, county staff, and contractual providers. At this upcoming board meeting, and then one of the metrics I'll have for this group to see is that balance. How many services do we directly operate? How much are contractual and why we make those decisions? And more efficiently, are we efficient? Are we cost effective? So we're still in the process. I haven't yet been here 90 days. Well, actually, it might be today as either interim or permanent director, 90 days today. And so I've done a lot of examination of the current kind of department and goals. And we have 2 major themes that will be presented to the CMH board and the community. One will be ensuring community and community mental health and how we're going to do that. And the other is becoming a center of excellence for mental health services within 5 years. And being a center of excellence is a tall order. It means that you are a leader in service delivery, outcome management, training, and people around the state go, we want to do it the Ottawa way. That's our big audacious goal, is to be a state and national center of excellence for community mental health services. I believe we have the infrastructure. We just need to plan the goal to do that. And that the first step of that is to ensure that the community are getting the services that they deserve. That's the first measure of excellence. So in the upcoming months at our board meeting, CMH board meeting and here, I'll be bringing in data and progress on that in terms of outcomes, terms of dashboard metrics of how many people we're serving each month, how many people we denied services to and why, in the categories. Because as commissioners, you will often hear, I called CMH and they said ... And I would like to make sure that the county commissioners are fully educated in at least the variables utilized to make our decisions and the stop gaps that we have to ensure that we are serving as many people as we can with the resources that we have. So that's kind of like a broad update. One of the questions I had for this particular group is, what type of information would you like on a monthly basis? And in addition to, say, utilization data, some outcome metrics, just a general update. If there are specific things that you'd like me to report on to this group, I'd be happy to do so. And you can either let me know now or send me an email, and we'll put together a monthly update report that is then posted in the packet and the public can see it before I even come up here. Happy to do it. So that's kind of like a general update of where we're at. There's so much going on. I would say that to the public and people here, we have a board meeting Friday. It's going to be a good one. We're going to do a lot of discussions about key elements of ensuring community and community mental health and what does excellence look like in various topics. So I encourage people to attend or watch. I'll take any questions or feedback.
Right, do you guys have any questions? Mr. Moss, did you
Nope.
have any? No,
I
you're
was
good.
going to wait.
Okay. So I guess a little bit of feedback on what we would like to see more of here, or, you know, the report. I love the reports that you're doing for CMH, the director's reports. And I think that would be really interesting for us to receive here as well. You know, then we can just get in a little bit deeper if we want to.
Great.
And then any metrics, you know, like the kinds of things that Gretchen asks questions about, the service levels, those are really helpful for us to know as well. So I know you're kind of already working through that a little bit with CMH, but that's what I would like to see. So I don't know if that creates a lot of extra work for you with a director's report, but even if you give us the one from prior, from the prior CMH meeting, that would be helpful.
I can do that.
Great. Anything else?
That covered mine.
Okay. Mr. Miedema.
Just another food for thought is maybe you have frequently asked questions that constituents have, and it would be nice to have a few of those presented to the board in saying, here's some of the questions that the public has. Here's been CMH's response to the questions, because it might help others that have the same questions lingering in their minds if they don't come to the meetings. It might be neat to have that occasionally, maybe not every month, but
Sure.
occasionally,
Maybe quarterly or something.
or as it deems necessary, like if you're noticing an
Yeah.
influx of certain questions or not even questions, concerns that people are bringing forward, and you can bring it forward to us. And I'm sure you're already addressing it CMH, but it would be nice for this board to also
Yeah,
have that.
you know, I had the opportunity last week to go to Compassionate Heart Ministries, and there was over 40 people, families there. And there were definitely themes in the types of questions. I was stood there for 3 hours and just listened of what they were expressing that led to exact different types of inquiry within our organization. So things like that, I think, would be vital. Like, okay, what are the themes or the questions that are asked? And it's what prompted me to say, even with our org chart, like, it doesn't help you figure out how to navigate it. It just shows you the department. You go, wow, now what? Who do I call? I'm getting a lot of calls. So, but yes, as needed. And then, you know, I'll just make it part of the report of like, there's one frequently asked question every time we come, bring at least one, because the public asks the same question over and over again.
Mhm.
Because we haven't necessarily answered it.
Right.
So,
Thank you.
oh, you're welcome.
And it ties back actually to your two themes.
Mhm.
So, you know, that would be to ensure mental health services for our community. So. yeah.
And the question of who do I call is something we've been hearing for a couple of years from the
Yeah.
community, that they have no idea who to call. So.
Yeah,
That would be
I don't even know who to call.
great.
I'll learn real quick. I'll know by the next time we meet, but it's one of those things, we're navigating a system that's developed for over 40 years and it's contracted and grown. But the level of complexity since I was the director last has increased a lot. The budget is 3 times larger and the regulatory requirements, or at least, I think we're like literally thousands of regulations we have to follow by 5 funding sources, and each have their own criteria of who's eligible. So answering the question, who do you call, is going to be a good exercise in establishing both ensuring community mental health and becoming a center of excellence. But what I wasn't going to do is just put all the phone numbers of the staff on the org chart, because then you just start calling people and hey, maybe at person 50, I'll get an answer. And that's an undue burden for the community.
Right.
Maybe attaching department descriptions to the, yeah.
Yeah. Yeah.
Anything else? No. All right, thank you.
Thank you.
Okay, next up, we have the Department of Public Health, and Adeline Hambley's down, but I think Lisa's here today. So welcome.
Morning.
Good morning.
Today on behalf of Health Officer Hambley, she's moving her son into college this morning, so she's going to be with us. The updates I'm going to share today are basically 2 time-sensitive issues as we move really close to the end of one fiscal year and get ready to start another. So they're just 2 things that really came to mind today that you guys have told us to come to you and let you know if we need additional funding or we're having concerns about positions. Although this position wasn't recommended with the new position requests that you received last week from at last week's board meeting, we're asking that you please consider reinstating the clinical health services manager position for fiscal year 2025 and reclassifying it as a licensed clinical health services manager, and at the same time reducing the nurse practitioner supervisor to a clinic team supervisor. For the past 20 years, our department has had a dedicated clinical health services manager that's acted to manage programs and resources for our health services delivery to clients. The previous clinical health service manager retired from her position in 2023, and refilling that position was put on hold so that we could best determine the needs of the department. During that time, and still currently, our nurse practitioner supervisor has stepped in to fulfill some of those duties of that manager position while still fulfilling her supervisor position. Over the course of this current year, it's been determined that there is a need for the clinical health service manager to be reactivated, and that the position should hold an appropriate medical certification to provide patient services if ever needed. This manager position oversees a team of approximately 28 staff, and the team needs a full-time manager, not a supervisor, continuing to work as an acting manager while also holding down her full-time job as a supervisor. This year, our medical director has also been stepping in and seeing patients each week, keeping her from some of her regular duties. And again, this is not a new position, but would be reinstating one that's been in place for the past 2 decades. In addition, not reactivating this position could result in delayed wait times for patients or cause liability concerns in the future. Commissioner Cosby, we know with your nursing experience, you know the importance of having an office manager separate from medical providers who are seeing patients on a daily basis. We can't expect a full-time nurse supervisor to continue on as acting clinic manager for a whole nother year. And for these reasons, we're asking that you please seriously consider reinstating the clinical health services manager position while at the same time reinstating the clinical health services manager position and then reclassifying it as a licensed clinical manager, while at the same time then reducing that nurse practitioner supervisor to a clinic team supervisor. So that's one of our requests, and a concern that's high on our radar right now, and we wanted to make sure that you guys were aware. Another time-sensitive issue. Oh, did you have a question?
No.
Oh, okay, I'm sorry. Thought I heard something. Another time-sensitive issue is that we've been working diligently to get the community spoke invoice paid for services that have been taking place from this past October of 2023, and they'll continue through this September. This board approved the 2024 budget expense last September. And for the past 10 years, including last year, Spoke submitted their invoice to the health department and it was paid. That invoice was submitted in March of this year, and subsequently we were told we needed a contract in order to pay the invoice this year. We then began working with Spoke to create the contract, which has required multiple edits after reviews by purchasing and then fiscal and then corporate counsel. And this took over 3 months. So just to kind of explain why this is coming a little bit late to you in the season. Once all of those changes were made, the contract was reviewed and approved by fiscal corporate counsel, and then finally by Administrator Anderson on August 1st of this year. Because of the time sensitivity, we checked with Jordan Epperson that same day, August 1st, and he confirmed the contract would be on the August Finance Committee agenda. When that agenda came out at 4:30 the day before the finance meeting, we noticed the Spoke contract was not included. Health Officer Hambley reached out then and asked Mr. Epperson if it could be added. He replied that the Spoke contract would not be included on the agenda per the Finance and Administration Committee Chair. He had no additional information on the contract. We were told that Mr. Anderson was out all week and he then CC'd Mr. Wetmore on the chain. We have received no additional follow-up. Commissioner Zylstra then asked John Anderson about the status of this contract at the last board meeting, and Mr. Anderson said he would look into it. No one in our department has heard anything else about why this contract was left off the agenda after we followed the procedures for having it placed on the agenda, and we received confirmation that it would be there. Therefore, we'd like to take this time today to provide information about the Spoke contract, to answer any questions you guys might have, and to make a formal request that this be approved through the ratification process or be put on the September 2024 finance meeting agenda for approval. As you know, this fiscal year ends September 30th, so in order for this invoice to be paid for work already completed, the contract needs to be approved by the end of next month. Senior epidemiologist Darrell Glasshauer and Spoke's Executive Director Tracy Bolo are here with me to share more information.
Good morning, Commissioners. Like Lisa said, my name is Darrell Glasshauer. I'm an epidemiologist with the Ottawa County Department of Public Health, and I'm here today to provide a little bit of context about Spoke. Just to reiterate, Lisa mentioned that these funds are approved in the current budget, so it'd simply be approving the contract for funds that are already planned for this contract. Spoke is also valuable to the community. It provides coordination, bringing people together, bringing organizations together that might work independently. So there are many nonprofits and community-based organizations that don't necessarily have a formal umbrella over them. Spoke provides the informal, formal structure for them to be able to coordinate and communicate and provide services to the community. It also helps reduce duplicated efforts. So Ottawa County has a strong philanthropic spirit. So if there's an opportunity to support the community through a nonprofit, the community steps up. But this could also mean that there are multiple agencies that could be working in the same environment. Spoke provides an opportunity to coordinate those services to make sure that there's not redundancies and duplicative effort. Also, if there's an idea for a new service, Spoke could be the coordinator between those to say, hey, there's an entity that exists providing this service already. Could you partner with them or provide resources to them or work on some part of the process that they're working on? Spoke also has a community-wide reach, so this is a benefit to all of Ottawa County. It helps address things that no single agency can address. It usually tries to tackle or approach those big problems, homelessness, access to care, important things in the community that there's not one entity who's responsible for addressing that. Spoke is a recognized community benefit. If you talk to hospitals, other nonprofits, faith organizations, they'll recognize Spoke and the benefit that they provide to the community. When emergencies happen, Spoke is there to help coordinate the nonprofits to make sure those resources are available if there's something that comes up. And then lastly, Spoke's services are leveraged by multiple county organizations, Community Action Agency, Community Mental Health, Emergency Operations, us at Public Health, DHHS, and even the Sheriff's Department. So this is a benefit to not just public health and the community, but also to other departments here at the county. And lastly, I just want to say that all across Michigan, this is normal to have a multi-agency coordinator. A lot of times in different counties, it's United Way. We do have a United Way here in Ottawa County, but it's been going through some transitions. It was United Way of Ottawa County. Then it was United Way of Ottawa and Allegan. Now it's United Way heart of West Michigan. So you can see that the service region has increased, and Spoke provides a vital supplement to the services that United Way would usually provide. So just to sum, the funds for this project are already in the budget. Spoke is valuable to the community, and this is a normal thing to have in any kind of county across Michigan. And so I'll be here to answer questions as well, and I'll pass it off to my colleague, Tracy Bolo, the Executive Director of Spoke, if you guys have any questions or if she wants to share anything else.
Good morning. Thank you
morning.
for listening to both Darrell and Lisa, and I'm here just to address any questions should they come up.
Okay, Commissioner Cosby.
So, Community Spoke, did it merge recently with another organization?
Yes, there were two nonprofits originally. Let me step back and say, my name is Tracy Bolo, and I started as the executive director of Lakeshore Nonprofit Alliance on January 2nd of this year. So I'm still also putting some of those pieces together. More than 10 years ago, Spoke was started with the intention that Lisa and Darrell had outlined, and it was a separate 501c3. Lakeshore Nonprofit Alliance was its kind of sister type of nonprofit and went with one executive director seeing those two different organizations. The boards last summer of those two organizations decided to merge, predominantly for administrative overhead type of situations. So there were two boards, two sets of financials, and we have a staff of 2.5 people. So it just became more of an administrative function than anything else. So it's the same team of people doing the same work. It's just in a different 501c legal and tax structure.
And did you, and just for public purposes too, because I used for a long time United Way in order to direct patients to the proper services or the things that they need, like housing, food, energy, transportation,
Mhm.
medication assistance, et cetera. So, and what I'm hearing is that Spoke was doing that work, and so, and then Lakeshore Nonprofit Alliance was as well. So you're building kind of efficiencies?
Yes, and this was the work that came out of United Way. So if you go back to 2011, it was United Way that was doing that work, and Spoke and Lakeshore Nonprofit Alliance. United Way was the fiduciary for both of those two organizations at one point in time.
Oh.
And like Darrell said, they've gone through lots of changes and stretching of their reach and their organization. And so they're strong partners of ours and continue to be.
Excellent. And one of the things I was noticing when I looked up Community Spoke is that there's a housing needs assessment that you purchase. Is that correct?
Yeah, that happens every few years, and we were just looking at when and how that should be happening. We also do work with the county strategic office and do a nonprofit community assessment as well. So data-driven and looking for the ways that we can support good decision-making across the county.
Okay, and is that the one, because I've been approached by Strategic Impact for potentially spending $20,000 on the housing needs assessment, and I'm looking at Spoke and thinking, have we already in some way purchased it with a $45,000 contract?
No, those
So
would be
just
two.
again, building efficiencies and using our resources wisely.
Yeah.
Yeah.
Good question. And no, they are two separate initiatives. We can work with Paul Sachs and his department, which we do for other things as well, to say, how can we help support those efforts?
Using the resources that we've already purchased, exactly. And being
Yeah,
aware there.
in theory.
it's-
So the contract that Lisa is referring to is for the services provided from October of last year to current year, September 2024.
All right. And we're kind of keeping our eyes on housing because there's 8,000 unit deficit right now. And so just being able to manage that, there are a lot of organizations doing things, but I don't think, and Paul's talking about having kind of county oversight of each of those projects and tracking to see where are we meeting our 8,000 housing deficit need? Are we on track?
Correct. And we're very much aware of that, as well as the multiple organizations that play in the housing market here locally and this different slices that they kind of work on. So I've been part of the health needs assessment that the community health has been part of. We also work with Lakeshore Housing Alliance that also is part of emergency type shelter, right? Another piece of that spectrum. And then also looking at both the county commission and Housing Next. And so one of the things that we try to look to is to say, how can we bring those folks together and see where's the right place for us to assist in that, if possible.
Yeah, because there's Habitat and there are two different habitats. There's Jubilee Ministries.
Yep,
as well, so-
yes, absolutely. And so those are members. So Lakeshore Nonprofit Alliance is a membership-based program, over 200 nonprofits, predominantly in Ottawa County, but we go as far north as Muskegon and south into South Haven and Benville. It spans the political as well as faith spectrum. So we have very large organizations to startups, churches to the whole kind of spectrum. So that's part of kind of what we look to do, is to bring those folks together and regularly. I just had a meeting this week with the Jubilee executive director, know both of the Habitat folks and finding out what are they working on, how are they partnering, and what are the area that they're covering, so that we can be clear in representing them into other conversations.
And no, the work that I was doing is kind of pre-budget planning. So I want to do due diligence ahead of time for, what's going on in our county so that we can plan properly for our budget dollars to go to the areas that will be most impactful. The other concern I have is around food. And I know, speaking to a couple of the pantries here locally and coordinating those efforts, because they all kind of have different kind of areas that they service and expectations. Some charge, some don't charge. And so, yeah, and Community Spoke and United Way, it just felt like, from what I was learning, that we needed coordination. So I'm happy to hear that, they're coordinating efforts, and hopefully there'll be some sort of campaign to get more information out to them, to let them know how you can be helpful.
Yes.
Because they're kind of doing it internally is what's happening. So, one food pantry in one community is finding that they can't service somebody because they live in a certain location. And so.
Yeah, it depends on each pantry as to how they approach their service model and what funding restrictions they have. And so my background comes in that. I used to be the chief operating officer at Community Action House and helped launch the food club over there. So familiar with the pantry model. We also, a lot of times, the service providers in those pantries don't want people to have to drive too far. So a lot of times it's also geography based for that very reason, for ease. But Spoke and LNA have played a role in making sure that those folks are talking to each other and understand where there's shortages and where there might be excess in order to streamline that across the county.
And hopefully it's like, I'm explaining it out loud, it might not make sense. I'm looking at Maslow's hierarchy of needs. What are the,
Yes.
those foundational elements that our community members need right now, and how are they struggling? And then how can we use the resources we have in order to be supportive?
Correct. Other
Those were my
questions?
questions.
One question, Lisa, that I have for you is, I'm curious, what are the contract dates that we're talking about here?
Yeah, do you have we can send them around. It's, do you mind helping me out? Thank you. The contract covers the current fiscal year that we're in, so October of 2023 through this coming September.
Okay. What? Do we have a policy of some sort as to when contracts should be approved? Like, do we normally approve contracts, 6 months? Do we normally put them in 6 to 7 months after they started for
Yeah.
approval? Or do we actually get them approved prior to the start of a contract period?
Yeah, that's a great question. So for the past decade, we've had this partnership with Community Spoke, and every year up until this year, they basically submitted an invoice for their services. They've submitted, I believe it's the minutes from the board, from their board meetings, showing that their board approves this partnership. And the contract has been paid. So that, at least I can speak for the last 2 years, that the contract, or I'm sorry, the invoice came in about halfway through the fiscal year, so approximately March. Last year, I know the invoice was submitted in March. It was submitted, we got a PO, and the check was cut, I believe, in April. And so Community Spoke did the exact same thing this year. They sent us their invoice, they sent us their meeting minutes. And I found out when I came back from spring break, so beginning of April, that we were going to need a contract for this year. And so we did start right then with working with Community Spoke on that contract, which actually, because they have a board, takes time. So we took them, our suggested edits, they made them. Then we took them, fiscal's suggested edits and they made those. And then we took them legal's suggested edits and they made those. And so that process took from April to approximately mid-July, I'd say. And that's then when we were able to submit. And because we knew it was later in the year and that this year had been a different process, and we're glad it's course corrected, right? If we need a contract, we need a contract, that's great. But it hadn't been done that way before. And so we were trying to correct that. And that's why in the end of July, we did reach out because we knew it was time sensitive to ensure that it would get on an August agenda. So hopefully that answers the question.
Yeah, so there definitely have been some issues with process and things perhaps not happening as they should, and that's maybe not just this situation, but countywide,
Right.
things have been too loose. So partly pointing that out because, so that took about 3 months, kind of sounds like,
Yep.
March to July. And if you are wanting to do this again next year, and we're looking at, a start date of October 1, we might actually want to be looking at submitting the next one now, if that makes sense. Going ahead and working through a contract for the next fiscal year, if that's something that's going to be desired, because I don't think we want to be doing contracts after the fact.
Absolutely.
Because it could be denied, and then you have a service provider who's, provided 6-7
Absolutely.
months of
And
service.
once we realized this year that was going to be a difference, I think you sort of get in the habit of things. And like I said, it's been a decade. And so it wasn't brought to our attention until late March, beginning of April. And as soon as that happened, we started the process. I think now we know we
Right.
have a contract that isn't going to hopefully take as much time to go through all of the different groups either, because we just had one. You know what I mean? It just was a few months earlier. So,
Yeah.
but yeah, definitely. It's something we've had for the past decade. It's something that was written into this year's budget. So it wasn't anything we were trying to do last minute. It's just sort of the way the process worked this time, that it took until July to get the contract where it needed to be.
Okay. And I would just say that if there's any other, situations or scenarios that are similar to this, that we'll just want to make sure that we tighten those up as well. So
Absolutely.
you don't hit the roadblocks.
Yeah, this is a unique situation, I'll say. Usually, our contracts are approved and before the services are provided.
Okay.
And we can get started next year as soon as we know budgets are approved and we have that money to provide.
Okay. All right. Yeah. And so, well, I guess part of what I'm pointing out is that your contract date sounds like starts October 1st. So
Correct.
you probably actually, maybe you don't want to wait completely till the budget's approved. Maybe you want to go ahead and start working on it. If that makes
Yeah,
sense.
we can work on the contract. I know we just
Okay.
can't submit it for approval until we know we have the funding there.
Okay. Sounds good.
It looks
right.
like Commissioner Zylstra has his hand raised.
Sure. Commissioner Zylstra, do you have a question?
Yeah, thank you. I appreciate that. No, I just want to follow up on what you were just saying, Chair Rhodey. Does that mean we could see that on the ratification list next week? And then a contract for next year be placed on the finance agenda at the earliest finance agenda?
I'm not going to speak to that because that is a process that the chair of finance and the board chair and the administrator work through. So
Okay.
I think that's a process that will happen as part of the normal county operation. Doesn't happen at this particular board meeting.
Okay, so I guess what I'm hearing House saying is that they need some certainty on this contract that for the last year. And what I hear you saying is that we can't give them that certainty.
I'm saying that I'm not the person in the position to give them that certainty. And so
Okay.
things still
enough.
need to continue through the proper process. Process is an issue. And so we're going to go back to proper process here. Okay.
Okay,
So it'll continue to be worked on, with the county administrator and with the board
Okay.
chair and with the chair of finance, as it should.
Okay, I mean, I guess, but what I was saying is that they were following the procedure and getting the sign out from legal and from administration. And then the process stopped at some point.
Because they had some rightful questions, and it is their duty to get their questions answered and figure things out before they put things on an agenda. Okay, so it's going to continue to follow that process, and I'm not going to put them on the spot to answer that at this
Well,
time.
no, I see what you're saying, but I guess for me, the process would have been to put it on the finance, have the discussion on finance, rather than kind of have an off the books discussion.
Well, thank you for your input. I
Okay,
appreciate it. Thanks.
all
All
right.
right, any other questions? Mr.
I think
Minema?
it's already maybe been stated here. I guess I'm pretty surprised that a contract would have been kind of just assumed before being presented to the board. It kind of puts the board in an unusual position to have to approve something for work that's been rendered for a year. To me, that feels kind of shady, actually. So I'm thankful to see that there's work being done to improve that. But I will say that's very concerning to me, and I can understand why it hasn't maybe come to fruition in the way that was hoped for by some. And I think there's still some, I guess I still have lingering questions about whether or not the board should be approving work that wasn't actually approved to begin with before the contract came before us. So, and what does that look like if we were to say no and the work's already been done, we weren't actually given the opportunity to even have that discussion a year ago. So it's just a concern I want to put on record. So,
Thank you.
I'm sorry you feel that it's shady. Like I said, I can speak to, I've only been in this role for 3 months, but I do know for sure that last year, again, while you guys were, in your roles, that the invoice was paid just like it had been the 10 years before that. And so, to be honest, I don't think we thought about that we were going to need a contract sooner because it's work that isn't any different than what's been done years prior. I think that there's a lot of trust there. And like I said, as soon as we received it in March and were made aware, and again, we're completely fine with that, right? We need a contract now and that's fine. We jumped on the process as soon as we knew. But I would love to know what you do need from us, because like you just said, that it wasn't put on the agenda because there were some other questions, but that information was never communicated back to us. All that we heard was that the finance chair said it wasn't going to be on the agenda, and then there has been no communication since then. And so again, that's why we took the opportunity today to bring this before you. But I think again, to improve that process, I'm just wondering how we can better our dialogue so that we do get to an answer sooner. Did you want to?
I think, I just want to address that it was over a 10-year relationship and partnership, and it was built on trust of continuing work. I too was surprised when I showed up and there wasn't a contract in place. And like Lisa, we worked together to put those right structures in place and already working on the next one for next year, knowing full well that that's the correct procurement process. And so again, both Lisa and I kind of jumping in, newer to our roles, as well as an internal appropriate process changing, trying to navigate it. So it's not necessarily that it was misconstrued. It was a well-established relationship and partnership between organizations for over a decade.
and I guess just, I appreciate that. I think there's just some lessons learned, like there is oversight for a board that's elected for a reason. And so I think maybe some things had been run that way for a period of time under the old board. And that doesn't mean that there can't be continued good work that continues to happen. It just needs to go through the right process. And that's all I would say.
I wouldn't disagree. And I guess the only outstanding question is to make sure that you had everything you needed. Because it's a new process for us as well. I had no problem sharing our proof of insurance, for example. It required me to track it down. but I just want to make sure that all of the paperwork you need, you have. And that was my last statement. Unless there were other questions.
Mr. Moss?
Well, I guess I'll just say, I haven't seen this until just now, so, thank you for providing it. And I had a quick question, I guess, for the administrator. Does the county require contracts for outside vendors and nonprofits before we pay them? Is that a requirement?
It's typically the practice, and yes, it's normally what we do. And for as far as this bill goes, it is still, we're moving through the process, so to get that one handled.
Thanks.
I think what I'm hearing is historically, we've just used this kind of MOU process. In the past, we have 2 new people at the helm. And so,
I guess I'm a little concerned as to how many other situations that we may have like this. I mean, is this just one out of a $250 million budget, or do we have a dozen? I mean, is this 100,000? Is this 1 million? Not with Lake
it's
Shore.
not just, yeah,
Providence.
not
No,
you.
no,
Yeah.
but in general,
bill's
I
not
mean,
that big.
I'm curious as to, are we just cutting, is the county, because this is not a board, the board doesn't cut checks, right? The board approves
Approves.
budgets and approves spending. But is the county, or has the county in past years just been cutting checks to outside nonprofits based on somebody's board minutes? That doesn't make any sense to me.
No, and I don't think it follows even our written policy that that payment cannot be based on like an email. It can't be based on, just things
That's
that are
kind of my-
haphazard.
Yeah, that's kind of my point, is I think it directly conflicts with the policy, the stated policy that's been in place for the last decade in the county. So I don't understand why, but, there's more questions and, I'd like to read through the contract a little bit.
Right, right. Yep. And just in general, Lisa, too, just a little feedback. In all honesty, it felt a little bit like you were writing a press article, the way that you relayed, this email and then that email. And, we want to have more of a working relationship here than, let me lay out for you all the potential wrongs that may have happened in back-end communications. So just in all honesty, if there's a need from the health department, we do want to hear it. But it felt a little bit like an attack mode in that presentation. And so I just would welcome you to just, share what your needs are, but I'm not really interested in having this hostile relationship with the health department. We would like to, work with you as a team.
Sure,
So,
we do not want a hostile relationship either. I'm sorry that you felt like, did you say, you said of a press article?
mhm.
I was trying to lay out the timeline because I kind of anticipated the question about why this was coming so late in the year. So I was trying to share when the invoice was received and explain the process of once we knew we needed a contract, how long. Not placing blame anywhere, but just that's what the process of how long it takes. And, our concern of getting it through in July as quickly as possible. And again, I think that's the place where when we do follow process and then we find out that it's just not put on the agenda and we find out when the agenda is released to the public. But then we also don't get any other communication about why, other than the finance chair said it wasn't going to be on there. That's dialogue we'd greatly appreciate too, to improve that process and that feeling of not being a hostile environment, is that back and forth communication and that opportunity for us to answer questions you have, or at least better understand why things aren't being placed on the agenda.
Yeah, so feel free to send us emails, and to be communicating with the county administrator. 100% of our communication doesn't have to happen here in
Right.
this setting,
Absolutely.
So, yes, please send us emails if you have questions.
And I know that Health Officer Hambley and Administrator Anderson have had conversations as well.
Okay. All right. Yep. And I do understand, you guys are dealing with, decades of how things have been. And, we need to shift.
Absolutely, and
different
we're more than
processes,
willing
so.
to do it. I was just trying to lay out why the timeline looked different this year than what you might anticipate or see in the future.
All right, do we have any
Thanks.
other questions? No. All right, thank you.
Thanks.
Okay, and so having moved through our committee reports, this is now our second opportunity for public comment. If you wish to speak, please come to the podium, state your name, and you have 3 minutes to speak to the board. Would anyone like to speak? Welcome.
Good morning, board members. Rebecca Patrick, Allendale Township. Obviously, I'd like to speak to the last discussion that we just had about the contract situation. And I totally agree with you. There should probably be a contract here. And there was apparently some type of miscommunication or misunderstanding or lack of process that needs to be addressed. But having had this whole entire discussion, nobody still understands what the issue is. What is the issue? Why is the contract not being approved? That seems like a simple question that should have been answered either through the repeated emails with the health department or even right here today. So that's still a bafflement to everybody, I think. Has the process been followed? Most definitely it has not, starting with the hiring of your legal team or starting with the hiring of Mr. Epperson. We could probably list at arm's length the number of ways process has not been followed in the last 2 years. So I think it probably should be addressed. And let's look at our accounts payable situation. Every month, this board gets a list several pages long of accounts payable. And I think Commissioner Moss's question is an excellent one. How many of those issues have contracts that probably should have contracts and do not? But yet we don't seem to be questioning any of those, but we're all about questioning the public health department in a way where we call them shady in a public forum when they're diligently working, trying to get you the information that you want. Thank you for your time.
Is there anyone else who has a comment? Good morning.
Hi, Chantal Martineau, Park Township. I'm glad to hear that you're working on preparing for the budget. And I'm happy to know that you're talking to food pantries and that you're aware of the need for coordination for the food pantries in different parts of the county. So I hope that this means that you will be reinstating the budget for the Ottawa Food Coordinator. Thank you.
Thank you. Any other comments? Okay, seeing none, as adjournment is at the call of the chair, we'll call